Namaste Vidya, myself Devi Neha Seni from Physiotherapy and Diagnostics, Jyoti Vidyapeeth Women's University. Here I am going to tell you about the male reproductive system, part 2. In this, we discuss about the rest of the part of the male reproductive system. First is the seminal vesicle. Seminal vesicle is an accessory gland of the male reproductive organ. So here we can see the seminal vesicle. These are the lobulated organs and 2 in number, and the length is 5 centimeters long, varying on the posterior surface on the bladder. So it lies on the posterior surface of the bladder. We can see this is the urinary bladder and this is the posterior surface, and this is the seminal vesicle. Now what are the functions of the seminal vesicles? This adds greatly to the bulk of the ejaculated semen and the fructose and other substances in the seminal fluid, which are of considerable nutrient value for the ejaculated sperm until one of the sperm fertilizes the ovum. Prostaglandins are believed to aid fertilization in 2 ways. Prostaglandins are believed to aid fertilization in 2 ways, that is, reacting with the female mucus, cervical mucus, to make it more receptive to the sperm movement, possibly causing backward, reverse peristaltic contractions in the uterus and fallopian tubes to move the ejaculated sperm towards the ovaries. A few sperm reach the upper end of the fallopian tube within 5 minutes. Seminal vesicle. On the medial side of each vesicle lies the terminal part of the vas deferens. As we can see, inferiorly each seminal vesicle narrows and joins the vas deferens and forms the ejaculatory duct. So here lies the formation of the ejaculatory duct by the fusion of vas deferens and the duct of the seminal vesicle. Now the blood supply of the seminal vesicle is via the inferior vesicle and middle rectal arteries, and veins drain into internal iliac veins. Now the ejaculatory duct, here we can see the formation of the ejaculatory ducts. There are 2 ejaculatory ducts, one on each side, and each is less than 1 inch, that is 2.5 centimeter long, and is formed by the union of vas deferens and duct of the seminal vesicle. Ejaculatory ducts pierce the posterior surface of the prostate and open into prostatic part of the urethra, close to the margins of prostatic utricle. Their function is to drain the seminal vesicle fluid into the prostatic urethra. So here we can see the opening of the ejaculatory duct into the prostatic urethra. Now the prostate. Prostate is an unpaired accessory structure of the male reproductive system that surrounds the urethra in the pelvic cavity. So here we can see the location of the prostate, which is surrounding the prostatic urethra. This is the prostate. It lies immediately inferior to the bladder and above the urogenital diaphragm, posterior to the pubic symphysis and anterior to the rectum. Prostate is shaped like an inverted rounded cone with large base, which is continuous above with the neck of the bladder and narrower apex, which rest below the pelvic floor. The inferior lateral surfaces of the prostate are in contact with the levator ani muscles that together cradle the prostate between them. So here we can see the levator ani muscle. This is the levator ani muscle, which is cradling the prostate. So this is the prostate having the base directed above, apex directed below. Now the 2 ejaculatory ducts pierce the upper part of the posterior surface of the prostate to open into the prostatic urethra. Now the structure of the prostate, it is enclosed within the thin, dense fibrous capsule. Inner loose sheath is derived from the pelvic fascia, that is prostatic sheath. It is continuous inferiorly with the superior fascia of the urogenital diaphragm. So here we can see the true and the false capsule. Then the prostatic venous plexus lies between the fibrous capsule and prostatic sheath. Now the structure of the prostate, it includes 2 lateral lobes, 1 median lobe, and anterior and posterior lobes. All are clearly demarcated in this diagram. The 2 lateral, 1 median, 1 posterior, and 1 anterior lobe. The anterior lobe is tissue lying anterior to the urethra. It has no glandular structure. It is only a fibromuscular tissue only, and The median lobe is cone-shaped region between the ejaculatory ducts and the urethra. The lateral lobes, right and the left lateral lobes, they are the main mass of the gland, continuous posteriorly, separated by the prostatic urethra. Posteriorly, the posterior lobe is there, which describe the posterior medial part of the lateral lobes, palpable through the rectum on digital rectal examination. Now the function of the prostate gland. Production of the seminal fluid, supplies nutrition to the sperm. Without this fluid, the sperm would not survive their journey in the female reproductive tract. Now the blood supply of the prostate is via internal pudendal, inferior vesicle and middle rectal arteries. All are the branches of internal iliac artery. Then the venous drainage. Veins form the prostatic venous plexus around sides and base of the prostate, located between the capsule and the sheath. It drains into internal iliac lymph node. Also communicates with vesicle venous plexus and vertebral venous plexuses. Now the lymphatic drainage. The lymph vessels terminate in the internal iliac and sacral lymph nodes. Innervation is by parasympathetic fibers arise from pelvic splanchnic nerves and sympathetic fibers arise from inferior hypogastric plexus. This is the arterial supply of the male reproductive system. Now age-related changes in the prostate. At birth, the prostate contains fibromuscular tissue with rudimentary duct system. This will continue for 9 years. At birth, at puberty, the testosterone levels increase, duct system increases, fibromuscular tissue condenses, and prostate becomes doubles the size. During third decade of life, follicles increase in size within foldings of epithelium. During 30 to 45 years, size remains constant, but infoldings are lost and become regular. After 45 years, it undergoes hypertrophy or atrophy because hormonal imbalance. So, understanding of age-related changes in the prostate can be done by this diagram. Now the penis. Penis is the pendulous organ suspended from the front and the sides of the pubic arch and contains the greater part of the urethra, that is penile urethra. Now the parts of the penis, it includes the internal root, external shaft and the glans. The root is the portion of the penis that extends internally into the pelvic cavity. In the diagram we have demarcated all the structures. Then the shaft, the length of the penis between the glans and the body. The glans is the head of the penis, has many nerve endings. Then the foreskin, it is a covering of the skin over the penile. So here we can see the penis and the different parts of the penis. Then the root of the penis contains the two crura, which are proximal parts of the corpora cavernosa attached to the pubic arch, and the bulb of the penis, which is the proximal part of the corpus spongiosum. So in this diagram we can see the bulb of penis, which is the proximal part of the corpus spongiosum. This middle portion is the corpus spongiosum, and these are the corpora cavernosa, which are attached to the pubic bones. The body of the penis is essentially composed of 3 cylinders of erectile tissue enclosed in a tubular sheath of fascia, that is Burke's fascia. So in this transverse section we can see the 3 erectile tissues, that is 2 corpora cavernosa and 1 is corpus spongiosum. The erectile tissue is made up of 2 dorsally placed corpora cavernosa, and the corpus spongiosum is applied to the ventral surface. And its distal extremity, the corpus spongiosum expands to form the glans penis, which covers the distal ends of the corpora cavernosa. On the tip of the glans penis is the slit-like orifice of the urethra, which is known as external urethral meatus. So this is the structure of the penis. We can see the glans of penis, the bulb of penis and corpus spongiosum, and the 2 corpora cavernosa. Now the external penile structures includes the corona glandus, which is the rim of the penile glands. Then the frenulum, which is a thin strip of the skin connecting the glands to the shaft on the underside of the penis. Both are highly sensitive areas to touch. Now the blood supply of the penis is via the deep arteries of the penis, the helicrine arteries. The proximal part of the corpus spongiosum and the bulb is supplied by the artery of the bulb of penis. Then dorsal artery of penis supplies the glans penis and the distal part of the corpus spongiosum. In addition, there is dorsal artery of penis. All are the branches of internal pudendal artery, and the veins drains into internal pudendal vein. Then the lymphatic, the lymph from the glans penis drains into deep inguinal lymph node, and the rest of the part drains into superficial inguinal lymph node. Then the nerve supply, sensory nerve supply is via the dorsal nerve of the penis and ilioinguinal nerve. Muscles are supplied by the perineal branch of the pudendal nerve. Erectile function is the parasympathetic and sympathetic control. The parasympathetic nerves causes the excitatory function on the erectile part, and sympathetic fibers causes inhibitory action on the erectile portion. Now the analogous structures in male and female sexual anatomy. It includes, in males there is glans, in females the corresponding organ is the clitoris. So this is glans and this is the clitoris in case of females. Then the foreskin, in males it is represented by the clitoral hood in the female. Then the shaft in the males is represented by the labia minora. Then the scrotal sac is represented by the labia majora, and the testis is corresponding to the ovaries in case of females. Now the applied benign prostatic hypertrophy, that is BPH. It is occurring after 50 years of age. Prostate gland is enlarged due to hypertrophy of the median lobe, forming adenoma. It compresses the prostatic urethra and obstructs the urine flow. It will result in formation of post-prostatic pouch of the stagnant. Next is vasectomy. It is the common method of male sterilization. In this, a short segment of each vas is excised and the cut ends are crushed and ligated. Next is prostatic carcinoma. It occurs after 50 years of age, and the carcinoma most commonly found in the posterior lobe of the prostate, and it presents pain in perineum, urinary obstruction and difficulty in urination. Then hypospardias. It is the opening of urethra on ventral surface of the penis. So these are the different degrees of hypospardias. So this completes the male reproductive system. Now the questions regarding the male reproductive system. These are: write short note on anatomical features of the testis. So in this we have to discuss about the different anatomical features, internal as well as external features, and its blood and the nerve supply as well. Then next is the hypospardias. It is the from applied part. And this is the exercise for your file. You have to draw and label all the structures in this transverse section of the testis. This is another exercise. In this you have to again draw and label this diagram of male reproductive system in your files. So this completes the topic male reproductive system. Thank you.